Hello, my name is Erica Reed, and this is the second portion of my presentation of the Hours and Virginia Woolf. In this second portion, I will go over four particular treatments that I think could be used for major depressive disorder. With these four treatments, I will highlight one in particular that I will kind of share why I think it's the better of the four when treating major depressive disorder. The first treatment is pharmacological treatment. And with pharmacological treatment, it is really good with reducing suicide. As we know, a lot of times when someone is suffering from bipolar or when they're suffering from depression disorder, many times that is followed by some sort of suicide attempt or actual committing suicide. And so I think that this particular treatment is really good to reduce and definitely, address that particular issue when it comes to a mental health disorder. Two of the medications that are definitely known for in the pharmacological arena is clozapine and lithium. I know that being in the mental health field myself, I definitely heard of many people with bipolar disorder taking lithium and actually it really being a really good medication and how it does decrease suicidal ideations and how it has helped many of my patients that I know that has actually taken this particular medication. Some of the disadvantages of pharmacological treatment is with these particular medications, the drawback is some people can't take them. So, for instance, a pregnant woman would not be able to take one of these medications. A pregnant woman cannot partake in this particular treatment due to the medication. And so, in the movie, going back to the movie, in the movie you will see where Laura Brown, she was pregnant, and while she was pregnant, she was on medication. So you do see where she, do have medication, but she would not have been able to participate in pharmacological treatment due to being pregnant. The second type of treatment, I would say, is psychological treatment. And psychological treatment, of course, can help you change your thinking patterns, improve your coping skills, so that you're better equipped to deal with life stresses and conflicts. And psychological treatments, of course, that's usually, actually going in, speaking with a counselor, and a lot of therapists using psychological treatments, they use cognitive behavior therapy, interpersonal therapy, behavior therapy, mindful-based cognitive therapy. And so with these different types of approaches, one is able to address their depression issues. The only thing about that is a lot of times with just this particular treatment, you don't really address all of the factors that, that may contribute to the depression. So if a person is dealing with depression, but if they have family members that, may have suffered from depression, this particular treatment doesn't necessarily address that. It addresses the individual versus the whole family. So I think that the psychological treatment is very good for addressing just an individual and, you know, how they're feeling and the things that they're going through and the things that they're dealing with. So this treatment is really good, but like I said, it only focuses on the individual. The next treatment is the family therapy based treatment. I think that, and this is where I'm going to highlight why I think this treatment is better. This treatment is really good because not only does it address treatment for the individual, but it also addresses treatment for the family. So this is where everyone can come in and really share and also learn about depression. I think that with family therapy based treatment, it is a learning experience for the individual that's actually suffering from depression, but it's also a learning experience for the family and gaining coping skills and, you know, learning how to interact with that person dealing with this particular disorder. Also, one of my favorite things about family-based therapy is the genogram. So, of course, in the movie you see how depression went from Laura Brown, and it was also passed on to her son. So you see how it went from one generation to the next. And I think that with family-based therapy, that addresses that, and it shows you where these disorders or even anything medical, any medical issues, it shows you where these things come from, because you create it's kind of like a graph, and it, you know, of all of your family members on your mother's side and on your father's side, and it, you know, shows who has high blood pressure, who has any mental issues, who may have had cancer, and it will show you everything that you need to know and pinpoint areas of concern that, you know, that could possibly be passed down from your ancestors onto you. So I think that family-based therapy is really good because you want to be able to look at the whole and not just one part. And so that's the really good part of family-based therapy. The last treatment is biomedical treatment, and biomedical treatment is really good. It more so focuses on the neurological portion of treatment, and so that really, you know, it's not really preventative. It's more so just addressing what's going on. So it doesn't help you necessarily prevent future things to occur. It just addresses what's going on, and it's more so just about medication, and that's it. Also with biomedical treatment, one of the techniques that's used is electroconvulsive shock therapy. And so again, being in the mental health field, I really haven't come across anybody that has had positive experiences with that. I've heard that, you know, it helps for a little while, but as far as it being a long-term solution, I have not heard anybody saying that, you know, they had it and they felt better afterwards and, you know, never had to get it. Now I have heard that people do have to go back and get, you know, multiple treatments of shock therapy, but I also heard that it just didn't work at all. So again, this particular treatment, it, you know, it just focuses on the brain, and it focuses on, you know, what's going wrong in the brain, and it doesn't really, like I said, it doesn't really give you any type of prevention or anything like that that will help you prevent future episodes of depression or anything. So these are my 4 types of treatments that I think that could be used with someone with major depressive disorder. Again, like I said, I do believe that family therapy based treatment is definitely the better treatment of the four, because you will be able to utilize a genogram, and you'll be able to not only address your issues, but you can bring your family with you. They can address their issues. It's a learning experience for everybody to learn how to, like I said, engage with someone suffering from this particular mental illness. And also it teaches the person dealing with the mental illness how to educate their loved ones on helping them to get through this. And it also shows you how these things can be, if they are passed down from one generation to the next, and how it affects the people in your family. So of course, if someone committed suicide, that is something that you can go back and trace with a genogram with this family-based therapy. So that is my diagnosis, and that is my treatments, which is pharmacological treatment, psychological treatment, family-based therapy treatment, and biomedical treatment. And again, I would definitely recommend family therapy-based treatment for someone suffering from major depressive disorder.